I suppose, like many governments around the world, when we talk about money, we talk about funding as well. And many governments had to pull together a funding package to respond to COVID. And that was really for Scotland, and highlighted in some of our government reports, to really protect the 4 key harms that COVID was bringing with it. Those harms included direct health impacts, indirect health impacts as well on the wider population, the societal impacts about the restrictions that it was placing with the population. The population of Scotland is 5 million, and the economic impacts with regards to the provision of direct services, and obviously stopping industry move forward with those restrictions. Our funding in Scotland for the COVID response in 2020-21 was just under £10 billion. So again, when we talk about money, we talk about where is the money coming from to actually fund some of the innovations and developments to respond to such crises. Another question that was raised as part of this panel discussion was, how can healthcare reduce the cost of chronic disease? And obviously COVID is included within that. Within DHI, and I was delighted to hear Emma's presentation about being patient-centred. We are very much patient-centred, and we believe that actually a lot of the cost can be taken out if we move the cost of treatment from the hospital environment into the environment of communities. And that is around, how do we prevent crisis? How do we prevent things when we talk about chronic diseases like diabetes, like crisis situations with COPD, and how do we allow more services to actually take place within the person's home to reduce cost, but also to increase accessibility and improve service delivery for the healthcare sector. So going back to the COVID response and some of the novel solutions and tools that were developed, we developed a number of tools in direct response to COVID. Things like the National Notification Service, which allowed, and we developed this within 52 days, which helped people and helped the public health resources that usually would have to telephone from call centres, everybody that maybe had an instance of COVID, help them digitalise that very quickly so that the population would understand whether they were positive or negative. We also incorporated decision support tools into the clinicians' hands around COVID, and also an article that I wrote specifically for the Health Management magazine was around hospital at home and heart failure patients being treated in their own home. And that was small-scale pilots undertaken in the Netherlands and also in Belgium. Now, one of the key points that comes back to show me the money is the evidence that you need to scale these innovations. What you need to understand is that at the end of the day, there will be a finance director, and that finance director will be asking for return on investment, cost effectiveness, cost benefit analysis. And the article that I wrote highlighted that actually a lot of the projects within digital health and care take a long time to get to a project pilot, maybe an RCT, but along the way you have to have cost effective and cost indicators that actually it is viable and feasible to actually scale those innovations. Moving on just to the negative notification service and the difference it made to the bottom line. I suppose, again, it's about building capacity and cost avoidance, especially when in the eyes of COVID, we didn't have the luxury of employing more staff to actually come into positions. So with this negative notification and positive notification service, we actually managed to optimize using the digital channel, with 75% actually doing self-service within 45 minutes of receiving a positive result. Now, what we can glean from that is that saves time for the actual service, and especially in the face of a pandemic, which again, nobody had planned for, so they didn't have the resources in place to fulfill that requirement. I suppose as well, the other question posed to the panel was, what's the impact on the healthcare industry after COVID? And I think there's key lessons and points to be made here. When I talk about industry, I talk about suppliers, I talk about the health service, I talk about the workforce and the skills, the patients, who are the customers to this service. And I think a few things have definitely changed. One thing is the demand for industry solutions has changed. Therefore, there is a bigger demand for digital tools for healthcare providers. And I think that, again, going back to show me the money, will actually be a positive for return on investment, because people can actually see how this can be scaled at pace. I think the second thing to consider about the impact is customer demand. People in all countries around the world have been dealt with differently from their healthcare services. And I think the demand and expectation going forward will be very different. People will expect more digital within their service. The workforce and skills have been optimized. And again, that can be only positive when you talk again about cost benefits and return on investment and being cost effective. Now, we know that the tsunami around skills is here. There's definitely a skills shortage. And therefore, that argument and case can be very much optimized, I suppose, for that investment to be made and for finance directors to show the money to improve the services. Fundamentally, there's new models of care now, that weren't here before the COVID crisis, that are now here. And I think the customer would not want to regress back to traditional ways of working. So from my perspective, and the article I wrote for Health Management, it was really highlighting how certain tools can help build that case for scale and use the evidence around return on investment, cost effectiveness, health-related quality of life.